Myself Mary Shubha, I am the CNS of Nirmala Multispecialty Hospital. We are following a standard precaution in our hospital to control the infection control and the patient safety and the community health also. Standardly we are maintaining like a hand hygiene and the biomedical waste segregation and the needle stick injury we are preventing, and isolation technique care also we are using in our hospital. When we find the patient has been infected, we are segregating the patient to the isolation room and maintaining the standard precaution. Now we are going to explain about the standard precautions what we are following in our hospital.
I am Krishnendu. I work as a staff nurse at Nirmala Multispecialty Hospital in Mysore. Today I will be demonstrating the steps of hand washing technique, 5 moments of hand hygiene and the biomedical waste management that we are practicing regularly in our hospital. Now we are going to explain the steps of hand washing technique. Hand washing is the most effective way to avoid the spread of infection in the healthcare environment, and it includes 12 steps and it takes 40 to 60 seconds. And the primary purpose of the hand washing include 3 key objectives. First one, the patient protection, to protect the patient from the healthcare associated infections, and the second one to staff protection, to prevent the healthcare professional acquiring infections, and the third one, environmental control. It helps to reduce and limits the harmful bacteria in the surface of hospital. Now I am going to show the 12 steps of hand washing technique in our hospital. First, we want to rinse our hand till the elbow. The second step, we want to apply enough soap to cover all the surface of hand. And the third step, we want to rub palm to palm in a circular motion. And the fourth step, we want to rub the right hand on the left dorsum with the finger interlaced. Repeat it, left on the right dorsum with the finger interlaced. And the fifth step, we want to rub palm to palm with the finger interlaced. And the sixth step, we want to interlock our fingers and rub the back of the fingers of both hands. And the seventh step, we want to rub the thumb in a rotating manner of both hands. And the eighth step, we want to rotate our tip of the finger on the palm in clockwise and anti-clockwise of both hands. Then the ninth step, we want to rotate our wrist to the elbow. Rub both hands from the wrist to the elbow in a rotating manner. And ninth step, we want to rinse our hand from the tip to the elbow. Then the 11th step, we want to close the tap using the elbow to avoid the recontamination, to wet our hands. The last step, we want to dry our hands. Now we are going to do the 5 moments of hand hygiene. Before touching a patient, we want to do the hand hygiene properly. After doing the hand hygiene, before doing any physical assessment like vital signs, or while helping the patient to sit up, ma'am, here we done to help them to sit up. After this procedure, we want to do the hand hygiene. The second one, when we are going to do any procedure, before that procedure we want to do the hand hygiene like wound care, IV insulin, giving medications, and here I am going to give medication. After doing the procedure, we want to do the hand hygiene. It's the fourth moment of hand hygiene. And the last, when we are touching the patient table or the surrounding, after doing that also we want to do the hand hygiene properly to avoid the contamination and to protect the patient and also for us. Now we are going to explain about the biomedical waste management in our hospital. In our hospital, biomedical waste management involves segregation, collection, transportation and disposal of hazardous healthcare waste to protect our workers and the environment.
Now I am going to explain in our Nirmala Hospital what are the biomedical bins we have and how we are going to segregate the waste in the hospital. We have 4 categories of biomedical waste management bins in our hospital. First one will come to the yellow bin. Yellow bin is like a human anatomical wastes like a cotton balls and the dressing materials, all the things we are going to segregate in the yellow bin. And the second one is red bin. We have in that all the plastic materials like we have like catheters, IV sets and syringes without the needle, we are going to put it into the red bin. And third one is the blue color. In that we are cutted ampoules and wires, we are going to segregate in the blue bin. And the last one we have the black color. In that we are going to put it a black like a food materials, plastic covers and tissue papers, and we are going to segregate it in the black bin. And the one more is last one, we are going to use a PPC. In that we have a like a needles and short materials, and we are going to segregate in the PPC to prevent the needle stick injury, and we are maintaining a PPC container. Now I am going to explain in our hospital how the transportation is going to be happen. He is the person who has been segregating the staff who is going to segregate the biomedical waste. He is using a proper PPE kit with the head cap, mask and the gown, and he is wearing the gloves and he is wearing the shoes also. Okay, this is the proper PPE kit we are wearing and going to segregate the biomedical waste management. He is going to empty a now yellow bag, yellow bin now. He is tying the yellow cover and putting it in the safe container, and next going to the red bin, tying the red cover, then putting it in the safe container, and third is going to the blue cover, putting knot and putting it into the safe container, and finally to the black, putting the knot and putting it into the safe container. Now the person is going to put a new cover after taking the soiled waste. He is going to put a new covers to the bins. Placing new cover to the yellow bin. Placing red cover to the red bin. Placing blue cover to the blue bin. Placing black cover to the black bin. Now he is closing the lid of the container, then transporting safely to the hazardous room.